Good afternoon, everyone. Allison Skyberg here with Consolidated Planning Group. We are also partnered today with Tawana Smith with Workforce Solutions, so we're happy to be here with you. I always like to cover a couple of housekeeping items from the very beginning. We are in webinar mode today, so we can't see you or hear you, but we do know that you're there, and the chat box is enabled. So if you have questions as we're going through today's presentation, you can certainly put those in the chat box, and we're going to get to just as many as possible. If you are listening to this on a podcast and you would like a copy of the slides, certainly just email us at contact@cpgcares.net. That's contact@cpgcares.net. And everyone who is registered for today's webinar will get a copy of today's slides and a link to the recording as well. So for those of you that are joining us for the first time, we welcome and we are glad that you're here. For people that have attended our webinars in the past, we are certainly glad that you're back. We do a lot of webinars on a regular basis, primarily to provide educational opportunities and advocacy for our loved ones with a disability, to help put the tools and resources in your hands to be able to make good decisions. The truth is all of this stuff and how we have to navigate it is a little insane. And I come to you as a parent and a professional, and again, a lot of these webinars were born out of my own frustration in dealing with navigating some of these things with my own kids with disabilities. So if you are ever feeling overwhelmed in your process and planning and all of these, things that you have to do or don't do, and you're accidentally going to mess up, you're certainly not alone. We have the Consolidated Planning Group YouTube channel, and all of our past webinars live out there, and you can subscribe to the YouTube channel for free. There's over 300 webinars on topics surrounding individuals with disabilities and things that you might need to know. And we try our very best to organize those and name them in such a manner so you can really find the topic that you're looking for as well. Consolidated Planning Group, we are a holistic special needs financial planning firm. We're in Sugar Land, Texas, but we serve families all across the U.S., not just in Texas. We have over 30 years of experience, top of the table MDRT, nationally certified as Social Security advisors and members of the Special Needs Planning Academy. We are an advisory and consulting firm partnering with families just like yours and helping navigating and planning for the future of our loved ones with a disability. We answer questions like, who's going to care for my child when I'm gone? How do we make sure that we have enough money in the right buckets to preserve eligibility for state and federally funded programs? How do we make sure that we can retire ourselves and still have enough money to fund a special needs trust? Or maybe how much money do we need in that special needs trust? So those are some of the things that we can do. We also help people open ABLE accounts, and we'll talk a little bit about that today, but ABLE accounts are definitely a place that an individual with a disability can have money outside of those Medicaid guidelines of how much money you can have to still qualify that won't be counted against them. So today, this presentation is Government Benefits 101. There's a lot of information in these slides today, and sometimes it may feel a little overwhelming. But when we start talking about government benefits, I think some of the very, very most important place to start is understanding some of the different programs, because we hear a lot of people say things like, my child's getting SSDI, Social Security Disability, versus their child getting SSI. And while it's true that some kids are getting SSDI under their own record, and sometimes they're getting SSDI under a parent's record, in general, when a child first qualifies for benefits, not always, but most of the time they're qualifying for SSI. So let's talk about the difference of the programs. The confusing thing is, first of all, you're not crazy. There are a lot of terms with the Social Security Administration that sound similar, and they have no similarity at all. And there are other ones that don't sound similar, and they are the same exact program, just being called something else. So Social Security is something that we know of, Social Security retirement. also known, you pay into the system SSDI, Social Security Disability. So the source of the payment is through a disability trust fund, and when you're working, you are paying Social Security taxes on wages, and you're paying into this Social Security system or SSDI system. Benefits are paid to the disabled individuals who are unable to work regardless of their household income and resources. Benefits are for workers and for adults disabled since childhood. They must meet the insured requirements. Now, one little thing that we'll kind of talk about on Social Security and Social Security disability, there is a such thing as benefits for minor children that maybe even aren't disabled. So if a insured worker, you the parent, has turned on Social Security retirement yourself or Social Security disability through the Social Security Administration, and you have minor children, then in that example, your kids would be eligible for a benefit under this SSDI program, okay? So the other program is supplemental security income, and this is also called SSI. So here we got the SSDI over there, and then now we've got SSI, so supplemental security income. Payments come from the general tax revenue, not the SSA trust funds. This is a needs-based public assistance program that does not require a person to have a work history. It pays disabled individuals who are unable to work and have limited income resources. So the unable to work part is a little bit questionable, and we're going to talk more about the substantial gainful amount. It is possible that a person could be working as long as they're not earning more than the substantial gainful amount and still qualify for SSI. Benefits for children and adults in financial need, but they must have limited income and resources. So one of the frustrating conundrums, if you will, is that, a lot of us have a loved one with a disability. Maybe they're a minor under age 18 and you have applied for SSI and you got denied. And it was a very frustrating experience for you because you can't even imagine how they could deny your disabled child benefits. The issue is that denial was based off of your income and assets. So when we're applying for SSI, it's based off of income and assets. And if the child is under age 18, regardless of the disability, the child, the income requirements are going to be coming from the parent. So they're going to look at the parent's income and assets, not the child if they're under 18. So one careful thing that you need to know is if you've been denied before and you kind of walked away with your tail between your legs, you're angry, you're frustrated, and you're never going back to the well because it was a very frustrating experience, your kids often will qualify for SSI and Medicaid when they turn 18. So even if they're under full guardianship, even if they live under your roof in your house, even if you claim them on your tax returns, once they turn 18, it's based off of their income and assets, not yours. And we're going to talk a little bit more about this. Now, I just want to mention there's some things that can be confusing because some of our kids work and some of our kids pay into the Social Security system themselves. And they have become insured under SSDI under their own record, but they've still not earned more than the substantial gainful amount, so they may still be eligible for benefits under a parent's record. Every once in a while, about a couple times a year, we'll have a kid that comes in and they have some coverage under SSDI under their own record. They qualify for childhood disability benefits under a parent's record and a little bit of SSI. And there's always one-off. I call them the stump the chump questions with the Social Security Administration. There's always one-off examples. There's always, cases where there's a deceased parent. There's other moving parts. And if you've got, very confusing situations, you can certainly reach out and we can definitely help you with that. So disability rules over age 18, SSDI and SSI, physical or mental impairment. Disability is expected to last 12 consecutive months or result in death. They're going to consider age, education, past work activity, and whether or not the person has the inability to perform substantial work activity. And they also, the Social Security Administration loves acronyms. They have acronyms for everything, and they also call a substantial work activity substantial gainful amount. They measure the work activity on their ability to earn more than the substantial gainful amount. So substantial gainful activity or substantial gainful amount for 2023 is $1,470 gross earnings per month. Okay, so that is considered SGA. And basically what that means to you is if you're thinking about applying for SSI, either yourself or for a loved one, if they're working and they're earning more than the SGA, they're automatically going to be denied. It's as simple as that. And we all know that we can't live off of $1,470 gross per month, but in the eyes of the Social Security Administration, this is considered a substantial gainful amount. And if they earn more than that, then they're not going to be approved for SSI. Because remember, SSI is a means-based program. It is for the disabled and the indigent. If the individual is blind, the substantial gainful amount is $2,460 per month, gross earnings per month. So they just announced the 2024 numbers. So the SGA for 2024 is $1,550 gross earnings per month. If the individual is blind, it's $2,590. Gross earnings per month. So SSI only uses SGA as a measure of work during the initial claims, and SSDI uses SGA throughout the life of the claim. Okay, so that is another measure. So a person that is getting SSDI can still work, but if you don't want to basically lose SSDI, then you want to ensure that the work and the activity with the work is less than the substantial gainful amount. Okay, so SSI announced their benefit rates for 2024. So this year for 2023, it has been $914 per month. If it's a couple and both parties are disabled, it's $1371 a month. And effective January 2024, that amount, that $914, is going up to $943, and for a couple, $1415 per month. So some of the things that you might be sitting here thinking and saying, hey, wait a minute, my kid is getting SSI and they're not getting $914. What do you mean it's $914 a month? Okay, there are some reasons why you might not be getting $914 a month. Most often, one of the reasons is that you have not submitted a rent agreement or a fair share agreement indicating that your loved one with a disability is paying rent. So a fair share agreement is basically the cost of the rent or the mortgage, the utilities, basically divided by the number of people in the household, and sometimes they include the food. I've seen them include the food. To me, the fair share agreement is more difficult, and oftentimes, depending on your level of debt service in your household and your bills, sometimes an individual with a disability, their fair share might be more than what they even get in SSI. So that tells me that you would need to use a rent agreement, okay? So SSI is designed to pay for food and shelter. So basically, as it stands right now, if you don't have a rent agreement indicating that your loved one with a disability is paying rent, then they're going to have a 1/3 reduction. So you'd be getting 600 and something instead of 914. So that is one reason why you would have a deduction. There is also a reduction for work, and depending on their ages, and there's some caveats to that, which we're going to talk about today too. But there is also reduction in benefits if they are working as well. So that may be another reason. Okay, now there is some proposed legislation changes that they're going to get rid of the need for the rent agreement. I have not seen anything published yet that it has passed, but I in a lot of the forums that we're on for special needs and with a lot of the attorneys and things like that, it's kind of on the block, but I haven't seen that it has been approved yet, which would then, if it does get approved, it would take away the necessity for the rent agreement or the fair share agreement. And one other thing I just want to mention here on the rent agreement and the fair share agreement, we always say, you're going to want to, consult a tax advisor or a CPA on, do I put this on my taxes or not? In general, and if you're collecting rent, then that would be reported on your taxes. It has been said before that if you have a fair share agreement and the individual is actually paying their fair share, then it does not have to be reported on taxes. I would tell you my own personal experience in reaching out to multiple CPAs on this matter. I think it's a mixed bag, and some would tell you that if you're charging your child rent and it doesn't need to go on your tax return, some will tell you that it needs to be. And if you Google that, you're going to find zero answers, is basically what I have found. So do your own research, reach out to a CPA or an accountant that you trust and kind of work it that way. I know in the past where we have partnered with the Social Security Administration, they have suggested specifically that if you're charging rent, then that should be put on your tax return, and that the fair share agreement would not be necessary. So thinking about, whether or not you qualify, SSI and Medicaid, a means-based test. So what they're talking about means is they're talking about your assets. How much money do you have? So basically, single, no more than 2,000 assets in their name. So when we have a child that turns 18 and they live under our roof, under guardianship, whatever they are, as long as that child doesn't have more than $2,000 assets in their name outside of a special needs trust or an ABLE account, then they're going to hit that means-based test. If we have children and we're applying for SSI that are children, minors under the age of 18, they're looking at married couples at $3,000 in assets, child and one parent at $4,000 in assets, child and two parents at $5,000. In all cases, you can have one house and one car, which are not countable. So as I just mentioned, it's one house and one car. So a lot of families have more than one car, right? So there are some ifs and buts on the more than one car, like if you owe more than it's worth, or if you were going to use that car for final expense. I mean, you can look on the Social Security Administration websites on the exceptions to having more than one car. And I'm mainly talking about families that are thinking about applying for SSI prior to the child with a disability turning 18. But it's kind of a slippery slope. And so if you have house and then you have a house and then you also have land, or you have a house and a rental property, it's a no-go. You don't even need to waste your time applying. You're not going to qualify, okay? So I think the main thing that you guys need to think about here is if you're thinking about transitioning and we're thinking about moving into adulthood with our loved one with a disability, let's make sure that they don't have more than $2,000 in their name. Now, some people think, I know, I'm just going to take the money out of the account. I'm going to close the account. I'm just going to move the money to my name and it's done. It's over. So there's the right way about moving money around and there's the wrong way about moving money around. So if your child has more than 2,000 assets in their name, there's a couple of things that you can do. Number one, that money could be moved to a first party special needs trust. That money could be moved to an ABLE account. And it could also be spent down for their benefit. And if you're going to spend it down for their benefit, that's totally cool. You just need to keep a record of that, okay? So just think of record keeping and always keeping good records when you're working with the Social Security Administration. So there's a couple of things that happen when a person does qualify for SSI. It's not forever. And your child could have a permanent disability, and it could actually even be degenerative. It could actually get worse, and they could mark them as a permanent disability, and they're still going to come up for disability review. And I mean, we've had one, and you're not supposed to come up for 7 years. I think it's 7 years, but we've come up like every 2 or 3 years, even though we're marked as the 7 years. So that's one thing, is that the disability review, reviewing the conditions to make sure that the individual is still disabled. But they also come back and do a financial review every few years as well, where you'll have to provide bank statements and proof that you don't have more than $2,000. So it looks like, okay, so we have a question that says, why do I have to report my son's wages every month? His SSI is always different. Can a fair share agreement bring up my son's benefits? So a fair share agreement or a rental agreement will bring an individual's benefits up, but there are deductions for working. And I'm going to defer your question just for a second, because we are definitely going to get there. And that is a very, very good question. And we're going to give an exact example of how the Social Security Administration reduces benefits based off of earnings. So number one, you do have to report your earnings to the Social Security Administration. You have to report them every month. I am a fan of doing it every month. It's due on the 1st, it's late on the 5th, and I suggest that you do it every month on the 1st. Just set yourself a reminder, it's easier. You can upload wages to the portal as long as they have the employer listed. Okay, so if a person gets a job, it's your job to notify them that they've gone to work and then provide the name, address, and phone number of the employer, and then they'll load that up in your child's system, and then they can log in and upload their pay stubs. Another way that you can send them in is by fax, and I know that sounds archaic, but they still use fax machines. It's an electronic fax through the Social Security Administration, but it gets routed to your child's record. Of course, you can walk them in, which I don't recommend, and I also don't recommend mailing them in. You can, but those are the lesser ideal ways to go about doing that. So I just want to talk about the Social Security Blue Book for a minute. This is good, and this is a good resource online for anybody who's thinking about applying for SSI. This is basically a medical impairment guide that the Social Security Administration uses to determine eligibility for benefits. Okay, so it lists conditions. So it has, the Social Security Blue Book has child listings, and it doesn't mean your child. It means if they're under 18, they're a child, and if they're over 18, then they're going to be in the adult listings. And they list impairments by category. It could be skeletal, it could be heart, it could be neuro. I mean, it could, it's all across the board. They list a lot of them by name. And so basically, if you're thinking about applying, I suggest that you look at the Social Security Blue Book and find out what kind of evidence that they are looking for to determine that your child is disabled. I also suggest looking at, I went to my PCP and said, listen, we're about to apply for SSI. Here's the evidence that needs to be proven. I just would like to see what record you would be sending them when they send the record request. And I want to make sure that the record reflects clearly what the disability is and what the impairments are as a result of this disability, because it needs to be clear or the application is going to be denied. So this is your friend, and this is online, and you should totally look this up. Don't forget anything minor. So, I mean, we might think of the glaring diagnosis, the biggest one, right? But a lot of our kids have multiple diagnoses, and it might, there may be, one major and then several minor, and it could be, it could be insomnia combined with anxiety and depression, along with being on the spectrum or having an intellectual disability. Those are all things that you should be looking up. Think of all of the things that may be affecting your child's ability to have substantial gainful employment. Okay, so what should you apply for and when? Apply for SSI the month of your child's birthday. Appointments should be scheduled a few months in advance for after they turn 18, so don't misunderstand me. If you're going into the Social Security office, they're very busy. They're very, very behind. So if you know that your child is turning 18 in February, I would call now or in December and get an appointment scheduled for the day after they turn 18. Don't go before, because if you go before, they're going to be counting your income and assets. You've wasted your time, and you're going to have to do it all over again. I promise you, it's a bad idea. So you want to make sure it's after they turn 18, and that is if you want to go into the office to apply. You can go into the local office, you can do it by phone, or you can do it online. And you're always supposed to be working with your local office. In Texas, it may not be true for other states if you're, from out of state, but it has been very, very difficult lately in Texas to get your local office on the phone. Most of the Social Security offices have been rerouting their calls to the call center, to the national call center, and then you sit on hold for about an hour, and then they tell you, oh, well, you should have called your local office. We can't really help you. So that is a true story. It's really happening, and it is very, very frustrating to many, many people, and it's kind of a circle. I don't have a good answer of the fix for that. So the other thing is last year they had released an online application tool for applying for SSI online. That's pretty nice. I like this option. It really takes 5 minutes to start an application, and it'll save the date of the application, and if approved, the benefits will be backdated to that date. When you are getting ready for your appointment. So basically, if you do it online, they're going to tell you, thank you, we've got this, and somebody from our office will be calling to schedule your appointment to take your application, is basically what will happen. And usually you'll hear from somebody in 2 or 3 weeks. And if you don't, you should call and follow up on that. But for the most part, I've been hearing that people have been being called. I have had one family that was stood up twice for their SSI application, their scheduled application over the phone, as the Social Security Administration actually did stand them up twice. So that, but that's not the rule. That is not usually how it goes. You want to have evidence. So I suggest you create a folder on your desktop computer for SSI. And you create the information and slide the information into your folder so you feel prepared for this application. A lot of people feel nervous when they're doing the application. They feel like they're going to say the wrong thing, mess everything up. And I feel like if you are more prepared, it goes a little bit smoother. So I recommend having evidence that demonstrates that the child's disability started prior to age 22, if it did, to qualify for childhood disability benefits, formerly called CDB. It's called CDB. It was formerly called DAC. And a lot of the Social Security Administration workers still use the term DAC. Disabled adult child and CDB is one and the same. Okay, so they used that term for 40 years, and then they changed the name a few years ago to Childhood Disability Benefits, now called CDB. Okay, we're going to talk about that more in a moment. Gather medical history, name, address, and phone number of all treating physicians, the PCP, psychologists, psychiatrists. They don't care about licensed clinical social workers. It has to be a DO or an MD. But don't forget the specialist, because a lot of people with a disability, they actually may see a specialist more than they see the PCP. They may spend more time at the neurologist than they do at the PCP. So get the names, address, and phone numbers of all of the doctors. The history, the medical history, what were the diagnosis, what was diagnosed, and what were the diagnosis dates. Medication, they want to know what is the individual taking and what is it for. They don't care about the milligrams or the frequency. What are they taking and what is it for? If your loved one is working, you're going to want to have the name, address, and phone number of any employer. You're going to want to have the last 3 months of pay stubs and the last 3 months of bank statements. If your child doesn't have an account, it is my suggestion that you open up an account in your name specifically. If your child's going to be under guardianship, that you open up an account in your name specifically earmarked for the SSI payments or any government benefit payments. That way, when they come to do a financial review, you don't have your own personal financials mixed in with your adult with a disability. So that way you're going to be providing the statement where the benefits go and not your own personal financials. Do you have to do that? No, but I strongly recommend it. So it is so much easier to just open an account where the SSI is going to go to than to have it commingled. I promise it's better. And as I mentioned, I would consider chatting with the PCP first to make sure what they have in their records, because from my perspective, when we looked at the records, there were some errors and it was just easily corrected by the physician. Okay. We have a few things in the chat box, so I'm going to read that out.
If you have a lot of them in the chat box right now. The first one starts with, why do we have to report my son's wages each month?
Yep.
His SSI
we covered,
different, is always different.
We covered that one. We covered that one. We're going to come back to that.
If a disabled adult child is receiving benefits, SSDI, under their parents' record, it is my understanding that because they are DAC, their Medicaid, Medicaid eligibility continues ME-DAC. Is this true no matter what amount of RSD they receive?
So I have heard of this, and under 1619B, basically, this is where a lot of people are afraid, like if they're getting SSI, their child is eligible for childhood disability benefits or RSDI, retirement survivor disability benefits under a parent's record. The fear is when they switch over from SSI, the $914 a month, to the 50% of the parent's record. So say, for example, in this example, the parent is getting $4,000 a month in retirement benefits, then that child would be eligible for $2,000 a month. So they would switch over from SSI to RSDI or CDB benefits under a parent's record. And under 1619B, there are to be able to continue to keep Medicaid. And I have not seen an example where they couldn't. I have seen an example where they had to reapply, and I've actually seen that a lot lately, where the switch wasn't flipped, whatever switch, the magical switch that they talk about, wasn't switched properly. So they actually did have to reapply for Medicaid, and also providing education to the Health and Human Services that they continue to get Medicaid under 1619B because they were getting Medicaid first. And so to the point of the person that commented, it's real important. This is a 1619B does not apply if the person wasn't getting Medicaid first. So this has to do with timing of when a person is going to pull the trigger on their retirement benefits. So if you're thinking about pulling the trigger on your retirement benefits and your child is a minor and they have not yet qualified for SSI and Medicaid, our advice is, as a parent, you should wait to turn on your retirement benefits. Obviously, if you can help it, if you're on SSDI, maybe you can't help that. But the reason you should wait is because you want your child to qualify for SSI and Medicaid first. So when they flip over to childhood disability benefits under a parent's record, then they will continue to keep Medicaid under 1619B. Now, the other thing is, and this is kind of a whole nother can of worms, but they are going to be eligible for Medicare 24 months. So once they're 18 and a parent has turned on benefits and now they're eligible for CDB benefits under a parent's record, after 24 months, they will also be eligible for Medicare. So they'll be dual eligible. Okay. So let's see. So I think we've answered that question. And then it says, I know if they are receiving SSDI on their own record, they may be eligible for Medicare Savings Program, QMB, SLMB, et cetera. But I have been told that if it's off their parent's record, they get to keep Medicaid, and Medicaid will pay the Medicare premiums and Medicare out of pocket. So I've seen the SLMB and the QMB, and if it's, basically on their own record and basically this is extra help or covering the Medicare B premiums is kind of what they're referring to here. And so then generally if they're qualifying for this under basically their own record and can still qualify for QMB and SLMB even if they're under childhood disability benefits depending on the amount. Okay, so one person says, my child is on a Medicaid waiver program. She just turned 18 as I am applying for SSI. Would it affect her Medicaid in any way? Do we need to apply for a federally funded Medicaid program? SSI comes along with Medicaid, and so it just depends. Like if the person is on MDCP, for instance, MDCP in Texas, there's Medicaid waiver programs in every single state, and they're different names. So if you're attending from out of state, just know that your state has Medicaid waiver programs, and they are named something else. But MDCP in Texas is until age 21, and so you may end up keeping your MDCP Medicaid, you get the SSI. So you typically have a caseworker if you're getting a Medicaid waiver, and they should be helpful on that. Okay, someone says, and I'm probably going to keep moving in just a second here. Can you address the pros and cons of a Down syndrome adult serving as his own legal guardian? Okay, so we have complete webinars on guardianship and alternatives to guardianship, and specifically speaking for the state of Texas, it's the law is the least restrictive, most appropriate for the ward. WARD is the word that they use for the individual. Least restrictive, most appropriate. And it just depends. It's a very slippery slope. And what I would say is you don't have to have all the answers, but if you will work specifically with a special needs planning attorney, and we can make referrals for that, They'll walk you through what your options are, learn a lot more about your child, and guide you on the right path. There are alternatives to guardianship. There is partial guardianship. There's supported decision-making agreements, power of attorney, healthcare power of attorney. I would say what the con is of not having guardianship is whether or not the person has capacity. So if a person has an intellectual disability, typically with an IQ of below 70, if it is questionable if they have the understanding to sign and have the capacity to understand what they're signing, such as signing of power of attorney or a healthcare power of attorney, then it's the guardianship or partial guardianship definitely needs to be considered. And we have seen in times past where a family did not have guardianship of an individual that they absolutely should have had guardianship, and when there was a health crisis with the individual with the disability, the hospital wouldn't take the power of attorney or supported decision-making agreement because they said that there's no way that the individual had capacity. So I would say have careful and thoughtful conversations with an attorney to walk through what your options are so you can make an informed decision. And there is not a right or wrong answer for every single person. But I think the thing that comes to my mind is if you died today and everybody died today that would be caregivers or successor caregivers for your loved one with a disability, could they live alone? Could they pay bills? Could they make decisions for themselves? Can they handle life on their own? I mean, one could argue that 18, none of our neurotypical kids can do that. And that's not what I'm getting at, but just thinking about, would your child be a fish out of water if they lost everyone that they had? Could they function? And could they navigate life? Could they get from point A to point B? Could they get to doctor's appointments? Could they deal with the Social Security Administration on their benefits and their benefit review? Could they fax in all the documents needed for the Medicaid renewal with HHSC? And if the answer is no, then I would say having those careful conversations with an attorney are going to be really, really important. So what should you expect after you apply? A decision usually takes up to 6 months and sometimes longer. I've seen it much longer, and I'm not trying to be the bearer of bad news, but I am also trying to be a realist to let you know that just because you apply for SSI, you need not think that you're going to start getting $914 a month next month. It's not happening. It's slow, and you should just plan on it not coming through because it is a very, very slow process. So have realistic expectations and don't be counting on that 914 coming in before you're actually approved. After your local office has finalized your application, it is sent to DDS, Disability Determination Services in Austin. Every state has a Disability Determination Service office. They're the ones that are going to request and review your loved one's medical records, looking for evidence of a disability. Now, the beauty of the Disability Determination Services in Texas, they actually answer the phones. It's fabulous. So you can actually call them. So after you've taken your application over the phone or however you did it, you could call them in a couple of weeks and see if they have your child's application. If you call them and they don't have your child's application, then that tells you that the local office has not even sent it to them yet, and nothing is happening. So that is your prompt to go down to the local office, call the local office, if they'll answer the phone, find out what's happening, and get them to get your application sent. Now, my own experience is that the Disability Determination Services, they're behind and they're understaffed. So my application for one of my kids took from July to March to get assigned to a caseworker. So it got to DDS in July, and it sat there and it did exactly nothing until March, until it was assigned to a caseworker. And this sounds extra, but I called every 2 weeks to find out what was going on. Who was it assigned to? Once it's assigned to a caseworker, they'll give you the caseworker's name and the extension, and this is helpful. And this is for the application process, okay? So once they've already been approved, DDS is not your place to call, but it is helpful that they actually do answer the phone. Okay, let's see. Tawana, bring me back to the chat box. Do we have a couple of questions? Okay, so I'm in a space where my child was denied SSI because of my income, but I'm unemployed now. He's 17 to be 18 in 2 months, and his case is in appeal review right now. So my question is, how does that work in this between time? So when he turns 18, how will this work out? Automatically look at his income, which is 0, and look solely at his assets. So the appeals are taking a long time too. I'm trying to even remember. Our appeal took from, I want to say, June of one year to July of the next year. That's how long the appeal took. And I'm not being a bearer of bad news, but realistically speaking. And so if there's a change of circumstance in 2 months and the child is 18, I would call to see if you just need to reapply based off of the fact that it's based off of their income and assets, not yours. I would say going to the local or providing DDS any additional information of the change of income, but everything's going to change when they turn 18. Okay, what do I need to do extra to get my clients back on Medicaid? Application was done in Texas Medicaid for more than 60 days, yet they are yet to respond. The Health and Human Services in Texas Medicaid is it's tough right now. Let's just put it that way. It's real tough. And their turnaround time is very, very slow. And you call 211 or you call the 800 number that comes on your letter for Health and Human Services. The hold times are long. You often get a person that cannot answer your questions. It is okay to politely ask to be escalated. We had an issue. In fact, we had an issue. 2 of our kids, we had to reapply, which is ridiculous. And it kind of went through a process. But once I finally got escalated and I got a person on the phone, they were telling me 45 to 60 days. I was like, no, that isn't working for me. You guys canceled Medicaid and it wasn't supposed to be canceled. And that's not working. I really need a team lead or a supervisor. Once I got the right person on the phone, they approved it right then on the phone, over the phone with me right then. So politely ask to be escalated, especially if many people have been canceled erroneously or wrongly on Medicaid lately. We've been hearing a lot of that over the last few weeks. So politely ask to get escalated. And then someone said, call the ombudsman line and let them know when the application was done and for what benefit. And they'll take a look and it'll be assigned to the caseworker, and then they have 5 days. So that's another way as well. So there is a lot of frustrations, and I'm hearing it in the chat box, and they're real. And it's not just you. I mean, it is. I mean, again, I mean, it's so maddening. When we had to reapply for Medicaid, they wanted to know what the disability was. Like, are you kidding me? Like, we've been on this program for this long, and for these adult kids, and now you want to know if they have a disability and what it is. Like, you lost all that information. So it is crazy, and it's very time consuming, and it's not a job for most of our kids with the disability. It's the parents' job. And I know, kind of just pulling all the documents. And the thing is if you don't pull all of the documents together that they ask for, your case is just going to sit and spin. So you really need to be methodical, look at what they're asking for, make sure you provide everything, all the proof of everything, if it's a driver's license or an ID or a social security card or the bank statements. And if they ask for 3 months, then don't give them 1 month, give them 3 months, because anything that you leave off of the list is why they're not going to approve the application, and it's going to start the whole train over. But it is a long time of pulling that together, so I'm sorry for that. So there is a such thing as presumptive conditions. Basically, if an individual has a disability that is on the compassionate allowance list, they can approve SSI for 6 months based off of that being on the compassionate allowance list. So this is going to be a link to the compassionate allowance list. You can also Google this. There's over 200 related conditions, but if there's a likelihood that the case will be approved, DDS can make that presumptive decision. So for some of you on here, you might say, well, gosh, it didn't take us a year. It didn't take us 6 months. It didn't sit and spin for 9 months at the disability determination services, but your child may have had a presumptive condition. And So that is why it was kind of fast tracked. So some of the presumptive conditions are allowable for compassionate allowance, amputation of a leg at the hip, total deafness, no sound or perception in either ear, total blindness, bed confinement or immobility, think inability to perform activities of daily living, feeding oneself, getting out of bed, toileting, transferring, bathing, stroke, more than 3 months in the past, continued marked difficulty with walking, using hands or arms, cerebral palsy, muscular dystrophy, Down syndrome, intellectual disability, IQ below 70, autism spectrum disorder with, I didn't say alone, with the inability to perform basic self-care activities such as the toileting, eating, bathing, dressing, transferring. Okay, so it's not just a slam dunk if you have a child that is on the autism spectrum. And when we have a child that's on the high functioning autism spectrum, it's definitely not a slam dunk. And when you have kids that are ADHD and they have frontal lobe issues and some of these other things, but maybe they don't have an intellectual disability, maybe they have the alphabet soup of every other kind of stuff going on, it's not a slam dunk. So you want to make sure that your doctors have things and how it is affecting the individual and their ability for employment. You want to have that well documented, or you're going to run the risk of being denied and having to appeal. So earlier we had a question in the chat box about working. Why do I have to submit my wages if I'm getting SSI? You don't have to submit they're going to track your wages, but you're submitting your wages for SSI. In fact, you actually do have to submit your wages for SSDI. But basically SSI, if you are getting SSI and you are working, here's how they're going to reduce the SSI. So basically, in the example that a person is earning $1,200 gross monthly earned income, there's a $20 general exclusion, and then there's a $65 earned income exclusion. So basically, they're not going to count the first $85. So in that example, we take the $1,200, we subtract the $85, that comes to $1,115. We're going to divide that by 2, and $557.50 is going to be counted as countable income. So they would take the $914 per month. They're going to subtract the $557.50, and then the following month, it's kind of a month behind, then their benefit is going to be $356.50 because they're going to take the $914 and they're going to deduct the countable income, and they're going to come up with a benefit of $356.50. So one thing that you need to be aware of, and a lot of people aren't, so I just want to take a moment to mention this, there is a such thing as a student earned income exclusion. If you have a student who is under age 22, between the ages of 18 and 22, regularly attending school, SSA doesn't count up to $2,220 of their earned income per month when they figure the SSI payment. So the maximum exclusion for 2023 is $89.50. So regularly attending school in college or university for at least 8 hours a week, grades 7 to 12 for at least 12 hours a week, in a training course or transition program, that would be another. You could be homeschooled in grades 7 to 12 for at least 12 hours a week. So you must ask for this, the student earned income exclusion. They don't just offer this. It's not automatically applied, and you absolutely have to ask for this. So if your child is between the age of 18 and 22 and they are getting SSI and they are working and you're reporting those earnings, and those earnings are being deducted every month as you go along, then you need to ask for the student earned income exclusion. It automatically ends at age 22. Okay, let's go here. So one person says, how do they expect us to live on the amount or less? They don't. I think it's designed to supplement or offset the cost of food and shelter. So I mean, it's not enough. It's far greater than it was. I mean, I can remember a few years back it being $715 or $741. So it's gone up substantially from what it was just even a few years ago. And it's the thing is I've heard families say before, like, well, I don't want my child to work, so lose the SSI. Well, if your child actually can work and they can make more than $914 a month, then I'm a fan of kids working and building experience and building their skills and building their work quarters under their own work record. So keeping somebody for that, you know, clipping somebody's wings that really wants to work and wants to try their hand at things in the name of $914 a month is not, I don't know. I don't think that that's the right answer either. And that also goes for parents that are trying to keep their income low enough to qualify for SSI and Medicaid while their kids are minors. That's problematic too, because if that's the case and you're qualifying for SSI, you get $914 a month. That's certainly not enough to care for a family, and the income limits that you can have under that is so low. You know, I don't know. It's just a slippery slope. The Red Book, the Social Security Red Book, serves as a general reference source about employment-related provisions of the Social Security, disability insurance, and supplemental security income. So remember, there's two different programs: SSDI, supplemental security income. And so the Red Book is going to tell you about the phases of work. There's 5 phases of work, and it's going to tell you about how earnings affect each of these programs. Now, we were talking about Medicaid waivers, and I don't want to like dance around or confuse anybody. There's a lot of Medicaid programs. There's a lot of different things, but Medicaid waivers, the eligibility for the Medicaid waiver is based off of the kid's income and asset, not yours. And that differs from what I've been telling you this whole time, because the Social Security Administration, SSI, if the child is a minor, it's based off of your income and asset, not theirs. So Medicaid waivers is different. So if your child comes up on a Medicaid waiver, it's going to be based off of their income and asset, not yours. And the income requirements are what is allowable under the Medicaid waiver is 300% of SSI. So that's 2742 for 2023 and 2900 and something for 2024. So that is the income amounts that you can have and still keep a Medicaid waiver. So those are kind of some different numbers. So some things that I just want to tell you, child support, before you apply, you need to have your child support directed correctly. So if you have a child that is under age 18, child support is going to be counted against you, okay, for income. If you have a child over 18, even though you're the recipient of the child support is going to be counted against them for SSI purposes. The way to fix this is to work with an attorney and have the child support redirected to a first-party special needs trust, and then it will not be counted against the individual. If you apply for SSI before getting this worked out, there's a pretty good chance you're not going to qualify. So again, this is a first-party special needs trust, and this is a big issue that we see. And also, not only that, it's a big issue that sometimes the Social Security Administration doesn't catch right off the bat. And then they come back 5 years later and say, oh, snap, you didn't tell us about your child support. Now we know about it. Now you owe us $150,000. So don't do that. Work with an attorney. Get that redirected. Don't be in a situation where you owe them a ton of money. RSDI benefit, childhood disability benefit, CDB. To be entitled to RSDI, retirement survivor, CDB, disability insurance, is 18 years or older. Or in a retirement situation, it could be minors without a disability. Disability began prior to age 22 to be covered under a parent's record, is a dependent of an insured worker, is not married, and has not previously performed substantial gainful activity, which we talked about earlier. Now, the one big thing I want to tell you, and because a lot of people have found this out the hard way, is your child qualified for CDB benefits because their disability started prior to age 22. And basically what that means is that when a parent either retires or goes on disability, that their disabled adult child or child eligible for CDB is eligible to 50% of the parent's record. So this is the example. They were clipping along. The adult child was getting SSI, $914 a month. Mom turns on Social Security retirement. Mom's benefits $4,000. Now the kid's going to start getting $2,000 a month. This will continue for as long as the child remains disabled and as long as the parent remains alive. At the death of the parent, this benefit is increased to 75% of the deceased parent's Social Security. Now, it is important to know that there are such things as family maximums. So if we have a spouse drawing off of the other spouse's record, or we have a family that has more than one special needs child drawing off of a parent's record. They can draw off of one or the other parent's record. If you had two kids, one kid could draw off one parent, the other kid could draw off the other parent. They can switch, but they cannot draw off of both parents at the same time. So if one parent retires early, they can draw off of that parent's record, and then the second parent retires and their benefit is higher, they can move over to that other parent. So someone says, my child received child support last month, and it is not dependable. Do I report what he received last month? You got to report it. The unfortunate thing, and it is very unfortunate, but if it is court ordered to get, and even if you're not getting it, they still count it. So you need to work with an attorney on that factor, which is frustrating because if you're not getting it, then paying an attorney to have this child support that you mostly don't get to go to a first party special needs trust, that's frustrating, but it is going to be counted if it's under court order, and we've seen a lot of families in this situation in the past. Okay, so SSDI, to be entitled to Social Security disability insurance, you're going to file an application. Found to be medically disabled, fully insured, not working, or working but countable earned income is less than the substantial gainful amount of $1,470 gross per month. So a couple of things that we want to talk about is how to protect your child's benefits. So we want to, first things first, ensure that you have your assets and your child's assets in the appropriate buckets. Again, an ABLE account, a special needs trust, is where you can have money above and beyond the $2,000 limit, and it won't be counted. You also want to make sure that your special needs loved one is not named as a beneficiary in any life insurance, investment, or bank accounts, because if they are left money in an inheritance that is over the $2,000, then they could lose their eligibility. And we also just always remind people, almost every webinar we have, we always remind people that insure well-meaning family members, mom and dad, grandma and grandpa, somebody that loves your kid that might leave them some money. Make sure that they understand that that money needs to be left to a third-party special needs trust for the benefit of said child and not directly to their name outright. If you have made this mistake on life insurance or other accounts, you can simply request a change of beneficiary form through the carrier. Maybe it's through HR, and you can change those beneficiaries, and you are definitely going to want to do that. And you can do that for free. You don't have to hire us. You don't have to hire an attorney. You can definitely do that for free. So we talked about my slides just went crazy. We talked about the ABLE accounts and the special needs trust. So basically, on an ABLE account, it's not going to jeopardize SSI and Medicaid or other public benefits, but there are some limits that you have to be aware of. The law has changed effective 2026, and you can have an ABLE account if the individual's disability started prior to age 46 coming 2026. But right now, the individual's disability had to start prior to age 26. An ABLE account is under the tax code 529A. It's achieving a better life for an individual with a disability. It's subject to the gift tax exclusion. You can have up to $17,000 a year into an ABLE account, and an additional $13,590 if the individual is working, and those are earnings. They can get paid earnings to their regular checking account. You cannot have earnings direct deposited to an ABLE account. That question comes up all the time. You can't do that. But the earnings could go to their regular checking account. You can turn right around and put those earnings into an ABLE account. That is completely legitimate. Okay? So there is a such thing as a Medicaid payback on an ABLE account. Another reason why you might have an ABLE account and a special needs trust is an ABLE account can pay for food and shelter without a 1/3 reduction to SSI. A special needs trust can pay for food and shelter, but there, as it is right now, as the law states now, there is a 1/3 reduction to excuse me, to SSI. The other reason you need a special needs trust, other than just an ABLE account, is you can't leave assets to an ABLE account, like an inheritance. Because again, we never want an ABLE account to go over 100,000. So you can read online that you can have 500,000 in an ABLE account, and you can. But as soon as it goes over 100,000, then basically you are not going to be eligible for SSI or Medicaid. Then those numbers are, excuse me, are going to be counted. So there's a long list of things that a special needs trust can pay for, but the main thing is it cannot pay for food and shelter outside of having a reduction to your SSI. So we're kind of come around the bend to the end of our webinar for today. I appreciate everybody being here today, and lots of good questions. You may have had questions that you didn't want to ask. Maybe you're shy. You can reach out, or maybe it's a personal situation that you didn't want to share. Definitely reach out. You know, we have a long list of things here to keep on your radar as far as future planning considerations. We have webinars on every single one of these topics. So if you wanted to know more about an ABLE account or special needs trust, first party and third party, or the Medicaid waivers in the state of Texas, or everything in general, ABLE accounts, everything, we have webinars on those topics on our YouTube channel, so you can peruse those. When you guys get the slides later today, they're going to have a link for the upcoming webinars that we have coming up in the future, so you can kind of see the ones that you might be interested going forward. We work on a collaborative team here at Consolidated Planning Group, and I always like to put some faces with the names. Again, nationally certified Social Security advisors, members of the Special Needs Planning Academy. Our whole firm is nuanced and special needs. So if you've got questions, we can certainly help you. And we've got a lot of resources and organizations that we work with that are also very helpful in providing resources and support in some of these journeys that you guys have been talking about, some of these real issues, and as far as these applications and benefits and things that are concerned. We always offer free personalized consultations. You may hear from our staff and to see if you had any questions about the webinar that didn't get answered, and offer you a free consultation to go a little bit deeper. So it's certainly been my pleasure being with all of you here today. Thank you for asking great questions. One person says, we have one last question. Do you have a point of contact of who can work another case with another case manager from another agency from Corpus Christi? Yeah, just reach out to us directly at contact@CPG Cares. We can certainly help with that. This QR code, if you hover your camera over that whenever you get the slides, it'll take you to our calendar. So if you want to book directly with us, you can book directly with us. Thanks so much, everyone, for your time. You guys have been great and great questions, and we look forward to partnering with you again soon. Take care. Bye now.